Good morning, Trinidad and Tobago and the wider world. A very warm welcome to the Ministry of Health's update on the national COVID-19 response for Monday, 20th September 2021. Our panelists for today's morning update are the Honorable Terence Dayal Singh, Minister of Health, Dr. Roshan Parasram, Chief Medical Officer, Ministry of Health, and Dr. Avery Hines, Technical Director, Epidemiology Division, Ministry of Health. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I am pleased to be the moderator for today's update. We will begin with the latest clinical and vaccination updates presented by the CMO, followed by a presentation on the Delta variant. Morning, CMO.
Hi, good morning. Thank you all. Good morning to the Honorable Minister. Good morning to Dr. Hines. Good morning to the media and the viewing and listening public. So we'll first begin, as usual, with the COVID-19 update for September 19th, 2021. So the total number of cases reported over the last 24 hours, 123. Our total testing so far now stand at 335,162. Total positive cases since the 12th of March are now 48,523, with those recovering at 43,059. Our total active positive cases are now over 4,048, and our total persons in home isolation standing at 3,585. Those deaths now stand at 1,416, and condolences to the families of those who would have lost loved ones during this pandemic. Total patients in hospital now at 280, those in step down at 60, and in state quarantine facilities 150. The Honourable Minister will go into further detail with regards to the vaccination drive. If I could have my second slide, please. So we're going to speak just briefly on the Delta variant. The earliest documented samples, India, October 2020. The date of WHO designation, variant of interest, April 4, 2021. Variant of concern, May 11, 2021. As of September 14, 2021, it had been reported in 180 countries. Now reported in all 6 WHO regions, the Americas, Europe, Southeast Asia, Eastern Mediterranean, Western Pacific, and Africa. Next slide, please. So the implications of Delta, as we said before, it has increased transmissibility and secondary attack rate, at least 2 times as transmissible as the Alpha variant. And the Alpha is the UK variant, if you recall. The Alpha variant is also 2 times more transmissible than the original Wuhan strain. Increased risk of hospitalization, faster replication. Next slide. It also has an increased infectiveness during the early stages of infection. And generally what happens if you have increased viral loads at that early stage is that people are in the asymptomatic phase or the pre-symptomatic phase. Therefore, if you have a higher viral load in that at that time, it lends itself to increasing transmission, and hence the reason it is more transmissible. Dominant in many countries such as the United States of America, the United Kingdom, Barbados, Denmark, and the majority of the European region. Next slide. So just to close on the Delta variant, all WHO-approved COVID-19 vaccines have demonstrated to be safe and effective, including against this variant. So we urge the population to come out and be vaccinated as quickly as we can. As we have been saying for the last few months, it is imperative that we get our vaccination coverage as high as we can to prevent the spread of this new variant in our society. Thank you, Al.
Thank you, CMO. I now hand you over to Dr. Hines, who will provide us with the latest epidemiological update. Good morning, Dr. Hines.
Thank you, Mr. Alexander. Good morning to the Honourable Minister. Good morning to the CMO. Good morning to the members of the viewing and listening public and the media. I'll go straight into the first slide for the epidemiological update, and that is with data as at September 19th, 2021. Next slide, please. Going straight into the epidemic curve, what we see using the color codes, using those colored sections, is that the continued plateau that we've been describing has maintained itself more or less throughout the month of September, September being the brown bars all the way over to the right-hand side. So the tallest bars are those for May, that's the gold color. Light blue is June, fuchsia, July, indigo, August, brown, September. And we're seeing that July, August, September that more or less hovered around a sort of a constant daily figure, and that's also reflected in that rolling average, that dotted line that runs through the graph, which is our 7-day rolling average, which has hovered somewhere in the vicinity of 200 or so cases a day. Next slide, please. Looking at that same information now aggregated weekly, so the weekly data shows a similar trend where the heights of those bars in the fuchsia, indigo, and brown sections have again remained approximately the same, and those still represent the July, August, and September period. We found that from one week to the next there may be small fluctuations in terms of percentage change going in opposing directions over the last few weeks. So whereas from week 34 to 35 we saw a 10% decrease, from 35 to 36 we saw a 26% increase, from 36 to 37 a 6.8% or 7% decrease. So we're seeing that sort of fluctuation going along week on week, but not with any clear upward or downward trend. This is what we describe as a plateau. And in the background of that, looking at that peach or salmon section, we see that what we call the positivity, the percentage of samples tested for COVID that test positive, that has continued to hover in between 25 and 30% over that about 12-week period at this point in time. Moving to the next slide, looking at the same information now at a monthly level, we see that the figures for July and August, because it's been a plateau, have been largely very similar, and we're looking at September on track to finish somewhere in that vicinity, if not slightly lower. And again, that salmon section in the background showing that between July and now, we've had positivity that has hovered between 25 and 30%. Next slide. The overall demographics for all the community spread that we've been seeing from July 2020 to the present time has maintained a fairly consistent pattern. That pattern being approximately half and half males and females, and about 50%, 51% of the total being in that working active age group 25 to 49. Next slide. By contrast, the fatalities have a preponderance of males at this point, a little less than before. So now we're seeing about 58% men to 42% women, and about 2/3 of the fatalities occurring in the over 60 age group. Again, emphasizing that along with age, the other factors that increase risk of fatality are those comorbidities, diabetes, hypertension, kidney disease, treatment for cancer, things that weaken your system's ability to respond to a new challenge. And because of that, we continue to encourage all individuals, especially those who have comorbidities, to make use of and to access the vaccinations to reduce your risk of serious illness and death. Next slide, please. Looking at the overall community map, we do see that for weeks 35 to 36, we're seeing some concentrations in more or less the sort of standard areas. We saw some activity over in the Sangre Grande region. We see some activity, darker colors, in Valencia and in various communities within County Caroni. Fairly darkish area down at the bottom there. I think that corresponds to St. Mary's Village in Victoria. And we're just looking at the changes from week to week. So if we go to the next slide, we actually see that between week 35 and week 36, the week 35, the older, being the purple, week 36, the newer, being the gold. If you look at the heights of those bars, we note that there are certain counties where we've been seeing an increase, and others where we see either a maintenance of the same or similar figures or a slight decrease. So looking at those bars, we see that the heights of the bars for St. Patrick, St. George West, St. George East, Nueva Mayaro, and Tobago for the week 36 are a little higher than the ones for the previous week. So there was an increase in those. And in the other counties, Caroni, Victoria, small decreases, St. Andrew, St. David, just about the same, St. George Central, small decrease. So again, we're seeing some counties having small increases, some counties having small decreases. And this, again, contributes to that overall plateau where we're not going higher or lower. But we need to continue to keep an eye on that, especially in the counties where we note that we're seeing an increase from one week to the next. Next slide, please. If you look at that same data now over a longer time scale, each of these clusters of bars represents weeks 25 to 36 for each of the counties. And we do see that County Caroni, there was something of a slow downward trend River Mayaro was running basically at a plateau until week 35 to 36, where we saw an increase. So too for St. Andrew, St. David, St. George Central. We're seeing some small downward trends for St. George East that then changed direction in this last week, and so on. So what we're seeing is that overall that plateau, similar numbers of cases from week to week over the last few weeks, but in that last and in the penultimate week, we've seen an increase in a few counties, and we need to keep an eye on that as we continue to try to maintain the reduction of transmission in the population. So with that, I'm going to turn you over to Mr. Alexander.
Thank you very much, Dr. Hines. I now invite the Honorable Minister to address some of the current issues surrounding the COVID-19 virus and the national vaccination drive.
Thank you very much, Al. Good morning to the Chief Medical Officer, Dr. Parasram. Good morning to Dr. Hines. Good morning to ladies and gentlemen of the media and all good citizens of Trinidad and Tobago, wherever you are and whichever platform you are listening, viewing us this morning. I would like to contextualize our vaccination rates, bearing in mind now that what we have been alerting the country about for the past couple of months, that is the arrival of the Delta variant within the population. It is now a reality. It is something we have been alerting the country to, and we have been alerting the country to do this, to take notice of it, and one of the mitigation steps is to get vaccinated. Where are we with our current vaccination totals up to close of play last night? Number of persons receiving their first dose, 558,811, which is basically 39.9% of the population of 1.4 million. Total number of persons getting their second dose, 464,129, which is basically 33.2% of the population of 1.4 million. Ladies and gentlemen, Dr. Janine St. Bernard and Dr. Joanne Paul were at Saturday's press conference, which I looked at home. And it was heartbreaking to hear them use the word beg, that they were begging the population to get vaccinated. I want to break down the figures. The number of persons who are eligible to be vaccinated in Trinidad and Tobago are currently those 12 and over. The 12 to 18 school population is about 90,000. Then you have those 12 to 18 who are not in school for whatever reason. So you have to add maybe another 10,000 to that. The number of adults 18 and over who can be vaccinated, as we have always been saying, is about 1 million. Therefore, the eligible population for being vaccinated, if my math is right, and CMO and Dr. Hines could correct me, is about 1.1 million. Does that sound about right? Yeah. 1 million adults over 18, and let's say 100,000 between 12 and 18. So let's talk about 1.1 million people who are eligible to be vaccinated. Of that 1.1, remember I said 558,000 roughly have gotten their first dose. The current number of persons between 12 and 18 who have received their first dose is 37,998. Let's work with some rough figures. Let's call them roughly 40,000. Minus that from 558, you have an adult population of 1 million and only about 510 to 520 of those adults over 18 who are vaccinated. It means that those 18 and over who have not been vaccinated, who are making up the bulk of our ICU patients, the bulk of the adults in home quarantine, the bulk of fatalities. If you do not make the decision now to be vaccinated in the context of 2 known cases of Delta variants amongst citizens of Trinidad and Tobago and 1 with a Venezuelan migrant. As we have been saying all along, and the international news media has been carrying it, the Delta variant is more transmissible, which means it moves from person to person and within communities faster. The outcomes are much more grave. I want to lend my voice and the voice of the CMO, Dr. Hines, and every healthcare professional who has been coming to these press conferences and even outside of press conferences. The Children's Authority had a webinar a few weeks ago and Dr. Joanne Paul was there. Every NGO in this country has been talking about vaccinations. The RHAs are going out in the communities and talking to people one by one. Some religious leaders, His Grace the Archbishop, the Anglican Church, the Dharmacharya, the Muslim community, have all come out in support of vaccinations. It is not too late today for persons to make that decision to get vaccinated. We have our sites open, 109 health centers, where you have a choice between the Sinopharm vaccine and the one shot and done. We have our mass vaccination sites. We have several private hospitals. We have tens of private physicians. We are doing pop-ups in malls, car parks, supermarkets. Make that decision now to get vaccinated. Let's talk to the school-age population, which is roughly 90,000. To date, 37,998. Let's call it 38,000 just to round off the figure. That is less than 50% of our school-age population, and many children want to be vaccinated, but unfortunately their parents see it differently. So in that entire 12 and over category, I have broken it up 12 to 18 and 18 and over, just to disaggregate it. We are largely unvaccinated, and we have been saying this for about a month and a half. We are about 5 to 10 percentage points off pace. By now, we should have been up to close to 600,000 having their first shot, and a similar amount, a similar percentage having their second shot. So we are not in a very good position to combat the Delta variant, which across the world, is wreaking havoc on lives, on economies, on hospital systems. And I am hoping, against hope, that the population is not becoming numb to the daily announcements of 4 deaths, 5 deaths, 6 deaths. Because the numbers, which are relatively small as opposed to 20, 15 in those very bad days, it is still 5 or 6 or 7 families that are hurting. And because it is not close to you, does not mean that you don't need to take care of yourself. As the old saying goes, when your neighbor's house is on fire, make sure and wet yours. So we are on fire. 5, 6, 7, 8, 9 people per day are dying. Our rolling 7-day average CMO is what? 99 currently. 199. Our rolling 7-day average is 199. I remember talking in these press conferences back in March when it was 3. Then it went to 6. Then it went to 16, and we started to bring this to the attention of viewers. Then it went up to over 400. And now people are getting comfortable carrying 199. Because 199 compared to 400, people may say we are doing well. But 199 compared to 3, where we were in March, look at that factor of increase. So we have always been giving you the data. Experts around the world have been giving you the data. And we have reached a place where the rate of vaccination, not only in Trinidad, but in many, many countries, has slowed. I want to tell you where our current rate of vaccination is for last week. Last week, between first doses, and then we add the Johnson & Johnson to it because it's a one shot and done. So between first doses of Sinopharm, AstraZeneca, and Pfizer, and Johnson & Johnson, we were averaging about between 2,005 and 3,000 a day. We should have been averaging about 4,000 to 5,000 a day. And it keeps dropping week by week. The week before, we were up to about 4,000. Week before that, 5,000, 6,000. And if you look at the newspaper today, coming out of Barbados, where the Honorable Mia Motley is saying 50 more thousand must get jobs. All of us, if we want this Caribbean space to be one that we could call home and have these cycles of lockdown freeing up eliminated, the answer now, and I'm urging the public, is to make that decision. It is not too late, but time is running out for you to make that decision. Before I close, I just want to say, with the concurrence of the Honorable Prime Minister, you may recall the Honorable Prime Minister at the end of the Cabinet retreat announced that 50,000 doses of Pfizer vaccines will be made available to adults. That means 25,000 persons could access it. To date, 23,315 adults have accessed the Pfizer vaccines. And the rate of acceptance among those adults was much higher than the rate of acceptance among children. The Honorable Prime Minister has agreed that another 50,000 doses of Pfizer will be put into the system for adults, because as the window of opportunity closes because of expiry dates, we don't want these vaccines to waste. We will still ring fence those doses for children, but I am urging parents, I am asking parents in a very, very sincere way. And I used this word last week. Don't let your children be sitting ducks for the Delta variant, please. So we are going to put 50,000 more doses into the system for adults because we don't want these doses to expire, which means another 25,000 adults 18 and over could access the Pfizer vaccines. So at the end of the day, ladies and gentlemen of the media and the public, please listen to the calls from health leaders around the world, prime ministers, presidents, the media, health experts locally, regionally, internationally, who are literally pleading with people. Now is the time to get vaccinated. And for Trinidad and Tobago, now that we have these cases of Delta variant with no known recent travel history, the time is now. Thank you very much, Al.
Thank you very much, Minister. A very sobering presentation. Up next is our question and answer segment. I know that our media representatives are all familiar with our format, where we ask reporters to state your name and the name of the media house that you represent Before posing no more than 2 brief questions, please identify the panelists to whom you wish to address each question. And of course, time permitting, we will accommodate a second round of questions. We'll take our first question from TTT. Good morning.
Hi, good morning to everyone. Sonal Lala, TTT News. Question to either the Minister or the CMO. Any further information you can give us in terms of the 3 Delta cases that would have been identified yesterday? When would these contacts, these persons would have tested positive, and the 2 unvaccinated people, what prompted them to be tested? Genetic sequencing that is, because they are persons that would have not had any travel history. And secondly, for me, the Pfizer vaccine in the US, a number of media sites are reporting that it has been proven to be effective in persons 5 to 11 years of age, and that is now ongoing to the FDA for approval in the coming weeks. Based on that, and I know, Minister, you just said that 50,000 are now being allocated for the adult population again. When is the expiry date for these 5 Pfizer vaccines? And if so, do we have any more, any shipments of Pfizer vaccines from the US coming if this is in fact approved by the FDA in the coming weeks?
Thank you, Sunil. So I will deal with the policy part, and then CMO will deal with some of the operational issues. So there were several questions asked about the Pfizer vaccine, ages 5 to 11, expiry dates, and whether we have more coming. Okay, good. So let me just see. If we pay attention closely to what Pfizer said this morning, they are going to make, from a policy, I'm talking from a policy perspective now, Pfizer is going to be submitting to the FDA data applying for EUL, Emergency Use License, or EUA, Emergency Use Authority, to administer the Pfizer shots to persons 5 and 11. The FDA, the US FDA, is still to pronounce on that. Again, if we pay attention, and you see the devil is in the details, what the details of that press release said is that the Pfizer data has not yet been peer reviewed. All that process will take place now. The US FDA is what we call a stringent authority that carries a lot of weight. But the US FDA has not yet, to the best of my knowledge, CMO, said to use it in 5 to 11. In addition to that, our policy in Trinidad and Tobago is to let WHO look at data from 193 countries before we make policy decisions on who receives vaccines and who should not be receiving vaccines, whether it's booster shots or children. The Sinopharm vaccine, I believe, is already before the WHO for sign-off for younger children. So that one is maybe closer to the finish line as far as WHO is concerned. Good. So I hope that answers that one. The issue of expiry dates, as we have said, the Pfizer vaccines expire at the end of November. So the term that we often use here, the window of opportunity for using the Pfizer vaccines gets smaller and smaller because we have to finish administer the first dose by around the mid to the end of October for the absolute latest, because we have to wait 3 weeks to administer the second shot. So we would like the Pfizer first shots, of which is 150,000, to be utilized by mid-October. We are not there yet, and that is one of the reasons that the Honorable Prime Minister has taken the decision to pump an additional lot of Pfizer vaccines into the system to vaccinate a further 25,000 persons. Right. Are more coming? These vaccines, as you know, were brought into the country due to diplomatic efforts led by the Honorable Prime Minister and supported by my colleague, Senator Amory Brown, and they are always in ongoing discussions with their counterparts to bring more vaccines into the country. As soon as we have details that we could take to the bank and say, yes, X amount is coming at so-and-so time, as we always do, we will come to the public with that information. Thank you for those 3 questions.
Okay, in terms of the Delta variant, so we have 3 cases that we said, bringing 3 new cases of Delta variant into the country. First case, as we said in the press release, it's a non-national person that would have recently traveled into the country from Venezuela. That person is, of course, being treated as an imported case. The other 2 cases that you asked about so far, at least overtly, the epidemiological investigation has begun. Overtly meaning that in the first instance, it is not apparent to us that there is any direct link to travel. And I think you asked the question why we would have tested those people. So about a month ago, we decided to expand the net of testing in lieu of what was happening with Delta across the world. And what I said in my presentation, that there are higher viral loads that we're seeing in the earlier part of the presentation. So the Trinidad Public Health Lab is looking for persons with a CT value, which is a cycle threshold value when we do the PCR test of 19 and less, and those tests are sent onwards for sequencing. So the 2 other individuals fell into those categories, and that's how we were able to pick them up as Delta variants. They have as I said, no link to travel in the primary contacts that we have interviewed so far. One is in St. George West, and one is in County St. George East. And the CMOHs in those respective jurisdictions are continuing the investigation, looking for possible travel links, and of course, isolating all the contacts that we find using the recommended discharge criteria, which is 2 negative tests at least 24 hours apart, to ensure that it doesn't go beyond those cases as best as we can. But the implication of being able to find it in random samples means that more than likely Delta is established in the community for a few weeks well. And that is the I hope that answers the question.
Thank you very much, CMO. And of course, I want to remind our media representatives to keep the questions to 2 brief questions. And of course, again, once we have time, we will come back for further questions. We now move to TV6.
Hi, good morning to the panel. Alicia Boucher from TV6 here. Minister, yesterday we would have heard a report by Marcia Piche, a woman, who claimed that the vaccine had killed her son. So I wanted to find out what are the ministry's preliminary findings in this case, such as which vaccine that person would have taken and so on. And secondly, is there any oversight as it relates to bodies in terms of when we're investigating these adverse effects and possible vaccine deaths? Is there any oversight from, let's say, regional or international bodies to ensure that our cases don't necessarily fall into a silo as it relates to worldwide case data? Thank you.
Okay, well, thank you very much for the question. So we would have spoken to the various RHAs regarding that matter. There's a similar case that would have occurred at one of the RHAs, and the clinicians there are in the process of, they sent us a preliminary investigative report as to what they found on clinical grounds. We have asked that they have a meeting with the family to explain their findings, and of course a final report will be generated and sent upstream to both myself and the Honourable Minister, in keeping with reports of that nature. And as soon as we get that final report, we'll be able to say a little bit more on that matter. But I have asked again this morning the officials and the clinicians at that RHA to meet with the family and disclose what they have found. By way of patient confidentiality, of course, we can't say what has been found at this point in time, but they will inform the family directly, and hopefully in the coming days we'll be able to say a little bit more about that particular case. In terms of upstream, if we do have any adverse reaction that occurs, and we said it before, we normally inform the Pan American Health Organization, and sometimes we will inform the actual company that manufactures that particular vaccine, so they will build it into their findings on a worldwide level so that they could actually see what's happening globally with their vaccines.
Thank you very much, CMO. We now go to the Newsday for your two questions. Good morning.
Good morning. This is Paula Lindo from the Newsday. My first question is, anyone on the panel could take it. Given a number of large gatherings that have been seen over the past couple of weeks, are the authorities concerned about an increase in cases, especially now that the Delta variant is in the community?
Could you speak a little louder? We're having some challenges hearing you. Paula, could you speak a little louder, please?
Sure. Given a number of large gatherings that have been seen over the past couple of weeks, such as the funeral of Gumbi last week and the festival of Ganesh Utsav yesterday, are the authorities concerned about an increase in cases? Second, could you give us an update on the safe zones that the Prime Minister would have spoken about a couple of weeks ago, and what is being done to implement these measures?
Thank you. So I'll take the second question first because that's a policy position. So as we indicated last week, we are working with the Honorable Attorney General to finalize these safe zones and how they will be operationalized. We hope to have that sewn up by the end of this week. And again, once we have a bankable project, we are just working out details now. The bankable project is there. We are working out all the fine print because, as we say, the devil is in the details. We will come to the population with the final product. But we are also in communications with the large organizations like food and beverage, the casinos, bars and owners associations. They have sent us their proposals. So the consultations go on and the work behind the scenes go on. Once we have something, as I indicated last week again, once the internal and external consultations are concluded, we will come to the public with a firm position. Thank you very much. And I'll turn you over to Dr. Hines to address the issue of large gatherings.
Okay, thank you for that very important question. Now, of course, any gatherings which occur at this point in time, while we know that we have coronavirus in circulation, and while we're now further aware that the Delta variant may also be in circulation in addition to the known pre-existing Gamma variant, any kind of gathering that we have that exceeds the numbers, and the numbers right now for gatherings are 5, and doesn't follow the general protocols for risk reduction, any of those gatherings will be of concern. We do want to continue to implore to the general population that these gatherings not take place, that we continue to adhere to the guidelines. And it's important to note that in other jurisdictions where they did have high levels of vaccination, much higher than ours, but reduced their restrictions with respect to gatherings and mask wearing, etc., they still did see an increase in the cases in spite of their vaccination levels, because the public health measures continue to add benefit, they continue to be important, and it continues to be really very crucial that we continue to follow those guidelines to reduce risk. So with the new information that we may already have that Delta variant in circulation, we want to renew the call to the population not to engage in large gatherings, because we really don't need to give the virus a chance to spread to large numbers of people in diverse households each time we gather in large numbers. So it's a very good question. It's a good opportunity to reinforce the importance of those public health measures alongside the need for vaccination. So thank you for the question.
And thank you very much, Minister and Dr. Hines, for the responses. We now go to 103.1 FM. Good morning.
Good morning, everyone. Sarah Chandu from 103 FM. My first question goes to the Chief Medical Officer, Dr. Parasram. If we could go back to those 3 Delta cases, I know you would still be gathering information, but could you say, without giving anything too much about the patients themselves, how many contacts have they generated? What's their health status in terms of how ill they are? When would they have tested positive for COVID-19? We know there's a delay between testing positive and when it's confirmed as a case, a variant case of concern. My second question goes to the Health Minister, Mr. Diyal Singh. Given that we do have concerns now about the Delta variant being a part of spreading in the population, I should say, concerns about that, could we be looking at a return of restrictions? Thank you.
Okay, so I'll take the second question first, because that's a policy position. The implementation and rollback of restrictions is the domain of the Honorable Prime Minister. The Honorable Prime Minister looks at the data that we present to him from time to time. We look at the historical data, we look at the current situational analysis, and then we try to project. We look at what is happening regionally, globally, and the Honorable Prime Minister listens, examines, and questions all the data. And then it is up to the Honorable Prime Minister in his judgment as to what measures are to be implemented. So I, as Minister of Health, am not in a position to say yea or nay to any measure. As usual, if any measure is to either be rolled back or re-implemented, the Honorable Prime Minister always comes to the public or delegates it to myself. So that is where we are with that on a policy position. Okay? Thank you very much.
Thank you.
Yeah, so in terms of your question, just expanding, and you're right. I mean, the epidemiological investigation has just begun. They would have been treated as positive cases maybe about a week and a half ago. So normal protocols would have been followed in the sense that persons would have been asked to isolate at home for a given period of time, and their primary contacts as well. So that would have been ongoing. But of course, we would have expanded the net quite significantly, actually looking for what we call the primaries to those individuals. Because as they have indicated, there's no history of travel. Then of course we have to go wider and see where they would have been in contact with one person or the other, and expand that net as quickly as we can to see how best we could contain the spread. And of course, going back to test, treat, isolate as best as we can for these cases. And I mean, basically, it is a matter of trying to contain to these geographic areas as quickly as possible. But again, with a vaccinated and a better vaccinated public, we have a better...
I just want to go back to the first question about measures. The issue of measures and this rock and rolling and yo-yoing between lockdowns and open up is something that is untenable in the long run. And we have been saying to get vaccinated. I just want to quote an article coming out of the Jamaica Gleaner, which was carried in the Express on Friday, 17 September, written by Michael Abrahams, who is an obstetrician and gynecologist, social commentator. Same thing he is saying there. If lockdowns, curfews, and other restrictions are stressing you out, and you are unvaccinated, your reluctance may actually be working against you and the rest of us. Although I am fully vaccinated, that is Michael, and believe most of us should be, I empathize with those who are hesitant. But at the same time, I realize that this hesitancy has the potential to hurt us. So to complete the answer which I gave, the solution to not having a further lockdown, a solution to keeping things open, a solution to go back to life as we knew it, is simply to get vaccinated. Don't delay, vaccinate today. And then these questions may become redundant. If we get more and more people vaccinated, that is the answer. That is the tool we have now. We have vaccines in large numbers, but a vaccine is only effective if it is in your arm. Not on a shelf in a health center, not in a freezer, but in your arm. So I really want to thank you for asking that question, to give us the opportunity to amplify, because we support the business community. We don't want to be yo-yoing between lockdown. But we have an opportunity now. We have the tool, and the tool is simply to get vaccinated. Thank you very much.
Thank you, Minister. CMO, Guardian Media Limited, you are up next.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so Minister Dayal Singh, my first question, well, both my questions actually are to you. Firstly, I just want to tag on to what Sarika was asking there. So you said that any lockdown measures and stuff would be announced by the Prime Minister, who would take into consideration advice and stuff from the Ministry of Health. But given this new development with the Delta variant, is there any discussion within the Ministry of Health, or would there be any such advice to the Prime Minister that, hey, maybe we need to go back to the drawing board a bit and probably tailor some timelines, some policies, anything like that? And my second question stems from the infection of Minister Webster Roy, who, despite being fully vaccinated, contracted COVID-19. Now, this has some concern for some members of the public, and I'm just such instances of a fully vaccinated person contracting COVID-19 still is occurring locally in Trinidad and Tobago. Thank you.
Thank you. So let's deal with the first question. We at the Ministry of Health, even before Delta, are always reviewing data and reviewing positions. But the final decision will be made by the Honorable Prime Minister, and it will be irresponsible of me to take that responsibility onto myself. The Honorable Prime Minister always looks at all the evidence locally, and he has a better picture of what is happening regionally and internationally, and makes the final call. On the issue of Ms. Webster Roy, vaccines have always been promoted as a way of doing three things. One, preventing you from getting serious illness. Two, preventing you from going into ICU or HDU. And preventing you from dying from the disease. You have a 99.4% chance, of not dying from COVID. We always have, since mass vaccination started around the world, what we call breakthrough infections, right? But vaccines do three things, as was explained at the press conference on Saturday, again by Dr. Paul. It prevents you from contracting serious disease, it prevents you from becoming an ICU statistic, and it prevents you largely, over 99%, of being a fatality statistic. As opposed to your last question, whether we track those data, I don't know if the CMO wants to come in there.
We do track a bit of it, as Minister would have alluded to, in the hospitalized cases as well as ICU, HDU, and deaths. So we're tracking those cases as being extremely important to the vaccine drive as well. So we do track those cases, but not in the general population as a matter of course. In terms of Delta and the protection by the different vaccines, just to give you an idea, AstraZeneca has been known to provide 92% coverage in terms of hospitalization. Pfizer would protect you from symptomatic disease 88% of the time with regards to Delta as well. So suggested it was highly effective, producing similar antibody levels to that following a natural infection, and it had a robust T cell and B cell response. And for Johnson & Johnson, a press release that they had released stated that it demonstrated strong and persistent neutralizing antibodies to COVID-19, including the Delta variant. So again, we have 4 vaccines that protect not only against the previous strains of this virus, to provide good protection against Delta. And again, we take the opportunity to urge everyone to have the vaccine as soon as you can.
Thank you very much. Power 102, we are ready for your questions.
Hi, good morning. Gregory Magrini from Power 102 Boom Champions and List 102.3. The first question is for Minister Dayal Singh. I heard you speak about the demand for the Pfizer vaccine. Can we assume that there's been a reduction in the demand for the AstraZeneca vaccines? And if so, what is the plan to ensure that they are utilized before they expire? And secondly, is there any concern within the cabinet about possible exposure to COVID, given that Minister Webster was tested positive, Dr. Rowley was exposed, and there was a cabinet retreat, I think, less than 2 weeks ago. And on top of that, ministers were in Parliament last week. So how are the members of cabinet feeling, and have they gotten tested?
So, as
Thank you.
a press release would have stated, the cabinet retreat was way before Minister Roy exhibited symptoms and way before her infectious period, and Dr. Hines could explain that again. The members who were in close contact with Minister Roy are in isolation. So that takes care of that one. And we alerted the Parliament, and we did everything that we are supposed to do. AstraZeneca, I'm glad you asked that question. Now that we have 4 brands of vaccines, the demand for AstraZeneca, for whatever reasons, has plummeted to almost zero. Last week, for example, and this is the pattern that you see weekly, the Sinopharm vaccines, people and persons will access Sinopharm vaccines. The Pfizer vaccines, on any given day, about 2,000 to 2,005 persons will access the Pfizer vaccines. With the Johnson & Johnson vaccines, the one shot and done, since we started it, let me give you the exact figure. I think it's over 12,000. Yes, 11,858 have access to Johnson & Johnson. Let me give you the daily rates now for AstraZeneca, because that is the issue. AstraZeneca, yesterday, no persons accepted AstraZeneca, I believe. The data I have here up to Thursday, 10 persons on Thursday, 7 persons last week, Wednesday, 13 persons last week, Tuesday, and that is how it goes. Whilst the demand for the other 3 are more or less constant, the demand for AstraZeneca has plummeted to almost zero. It's down in the teens on a daily basis. The issue with the AstraZeneca, and I'm glad you asked it, is that AstraZeneca, as you would remember, have always come with a short expiry date. In the early days, it was 2 months, I believe. Then I think the most we got CMO was, what, 4 to 5 months?
No, just under 3.5.
Just under 3.5 months. So we have always been limited with the traditionally short expiry dates with AstraZeneca. As we indicated last week, and I indicated I was on we were on CNC3 this morning. I was on 95.5 last week. We started to alert through the Ministry of Foreign and CARICOM Affairs, again, with the permission of the Honorable Prime Minister, that we look for homes for these AstraZeneca doses. And the Minister of Foreign and CARICOM Affairs was alerted to this in mid-August. We also alerted PAHO through the COVAX facility that, look, we have these doses. We are giving you a full 2 months notice. So any country, any donee country, any receiving country, you have a full 2 months to accept and utilize AstraZeneca vaccines. So that is where we are with that, and the Minister of Foreign and CARICOM Affairs and also PAHO will be looking, and have been looking over the past month or so, for donee countries to accept these AstraZeneca doses. Thank you very much.
Thank you, Minister. CL Communications, you are up next.
Hi, good morning. Are you hearing me?
Loud and clear, please ask questions.
Okay, so my first question is, can you give an update on Trinidad's assistance to Tobago, given that one young person got sick after taking the Pfizer vaccine? And then October 1st, they say they are dissatisfied with their contracts. Is the minister aware of this, and is anything going to be done? And then lastly, can you give some details on your communications and how it's going to change this week, given the fact that you're going to be informing the public and trying to reach the grassroots to get them have a wider understanding of COVID-19 and the vaccines?
Thank you very, very much. So the issue of Tobago, the CMO, I think Tracy Davison Celestine, the Secretary for Health and Wellness, spoke about it this morning. A statement has been issued. And I think we could rest on that until further information becomes available. On the issue of nurses, that is engaging the attention of the Ministry of Health and the RHAs. It is being actively looked at. It is not something that we are ignoring at all. And what was the third question, please? Just remind me quickly.
Grassroots,
oh, yes, engagement of grassroots. So we have been engaging the grassroots for about 2 months. You may recall that the Eastern RHA went literally house to house, community to community. When we started off with the Johnson & Johnson one shot and done, it was actually reserved in the first week for rural communities, coastal communities. We have been talking to people at the household level, at the community level, as all countries are doing, trying to give them all the information. We have been taking vaccination drives into community centers. Myself, MP Lakram Bodo did one yesterday. He did 88 persons. MP Fitzgerald Hines did one last week or week before. That yielded 153. We were at Citygate. That yielded 77 around there. Many persons, MPs, churches, mosques, mandirs, are literally going to persons one by one. Councillors, MPs. And yes, our communications plan is always evolving. Take into consideration, we are trying to reach different layers of people. So you will see a different communications execution coming out this week, but under the rubric that we have been using for the past month or so, don't delay, get vaccinated today. So that strategic message stays. Don't delay, get vaccinated today. But how we communicate that message is evolving as we reach and try to reach different bands of persons, going deeper and deeper into society. Thank you very much for that question.
Thank you very much, Minister. We go across to Tobago Channel 5. We are ready for your questions.
Hi, good morning. Candice Jackson from Tobago Channel 5 News. My first question is, has the Ministry of Health made any considerations or made a plan B if we do not reach herd immunity in Trinidad and Tobago? And secondly, Dr. Parasaram, when you were explaining a little bit about the Delta variant, you mentioned that it causes secondary attacks. And I was wondering if you could just elaborate a little more on what you meant by secondary attacks.
You want to go first?
Yeah. I mean, secondary, what we see is that you're getting 2 attacks, sometimes in someone that would have a previous COVID-19 infection. You get another bout of COVID-19 in that same individual. Generally speaking, that's what you mean by a secondary attack. So,
thank you very much.
Okay, thank you. So, you were asking if there's a plan B. There's a plan A, B, C, and D. The plan is simply to get vaccinated. At this point in time, there is no alternative to be vaccinated. The alternative, because, everyone who tells people not to be vaccinated, you realize they never tell you what is the alternative. They just send out their anti-vaccine messages telling you not to get vaccinated, but they never tell you what you should do to save your life. They never tell you what you should do if you get COVID. They never tell you, if you get COVID, come home by me and I will pay for your hospital stay. And if you die, I will support your family. So the conversation is to drive vaccinations. At this current time, there is simply no alternative to vaccinations. Vaccinations will save your life. And I want to go back again to what Dr. Michael Abrams said in the Jamaica Gleaner. He said, a recent analysis from the data from the United States has found that unvaccinated persons are 29 times more likely to be hospitalized and 11 times more likely to die than those who are not. So what is the alternative? The only way out of this right now until an alternative comes up is simply don't delay, vaccinate today. Thank you very much.
Thanks, Minister. AZP News, you are up next. Good morning.
Good morning, Private Harry, AZPnews.com. I was looking at the active cases, and I see that over the past week or so, it has started to increase and is now over 4,000. I don't know, CMO, do you think that is a result of a Delta variant that is present in the community? And my second question is, has any of the COVID-19 deaths, any of the patients had contracted the Delta variant? Thank you very much.
Okay, so none of the, at least none that we know of the deaths that have been sampled have turned out to be positive for Delta. The increase, yes, we have seen a slight increase in the active caseload so far. It means that the amount of cases that we have outstripped the number of discharges. So you're starting to see a gradual increase in the number of active cases. What is important to note, though, is although we're seeing the number of active cases increasing in the community, we're not seeing it, as yet at least, reflected in the number of persons being hospitalized, which is a very good, at least is a very good statistic to keep an eye on. So we noted the increase. Again, I think it's multifactorial. It's a little bit too early to say whether it is Delta variant or some other reason for those increases. But again, it has been noted, and notably, the hospital levels are still holding, at least for now. And that's where we want it to stay.
Thank you very much, CMO. And we close with I-95.5. Good morning.
Yes, good afternoon to everyone. Whitfield Jenner, I-95.5. CMO, have any samples from Tobago been recently sent for gene sequencing? And if yes, can you tell us what the results have been? And secondly, the adverse reactions, how likely is it that adverse reactions may be happening and are not being reported to the ministry? And any idea why that might be the case? Thank you.
So your first question, yes, sequencing occurs quite often. I've been in contact with Dr. Hoyt, who actually tells me a lot of times when they send samples or clusters of samples across. Mostly they have yielded, I would say, in terms of P1, which is the Gamma variant, and some of the original Wuhan strain to the majority at this point in time. None of them so far as I'm aware, have yielded the Delta variant. With regards to your second question, you're asking, just repeat your second question, please, quickly. So when someone has an adverse event, generally speaking, they go into a hospital, they seek care in an emergency department or seek care at a private physician in some instances. So generally speaking, adverse events are usually reported upstream. So I would say the majority of adverse events, we have some idea through the eSAVI system, which is an electronic reporting system housed in the Ministry of Health under the manager of expanded program of immunization, as well as through the regional managers of nursing, which actually report back into her as well. So we have a good sense of if we're getting adverse reactions. Of course, side effects are completely different. Those are milder events, fevers, body pains, and the like. Generally speaking, those side effects are not reported.
Thank you very much, CMO. That's all the time we have for question and answer segment. As we close, we ask you please to continue to protect yourself and your loved ones. Please follow all the recommended personal health protective measures, even if you are fully vaccinated. Wear a mask over your nose and mouth when you go into public areas. Keep your distance from others, 6 feet. Wash your hands often with soap and water or use an alcohol-based sanitizers. I know you've heard this before. Stay home if you are ill. Cough into a tissue or into a crook of your elbow. Avoid touching your face. Sanitize your hand surface or hard surfaces as often as possible. Don't follow or fall for fake news, people. The public is encouraged to visit reputable sites such as PAHO, WHO, CDC, the Ministry of Communications, the Ministry of Health's website, you know it, www.health.gov.tt, as well as the social media pages of the Ministry of Health and the regional health authorities. And basically that's it for now. We also remind the population of the importance of being vaccinated against the COVID-19 virus as soon as possible. The MOH only uses WHO-approved vaccines, and they are safe, they are effective, and they are available all over Trinidad and Tobago. If you haven't received your COVID-19 vaccination as yet, please get yours now. Don't delay. Vaccinate today. Goodbye for now.